In 1910, you could walk into any American pharmacy, hand over 35 cents, and walk out with heroin. Not on the black market, off the shelf. Labeled, packaged, and recommended by the American Medical Association. What changed was not the medicine. What changed was who stood to profit from it. These are 25 medicines that were legal, widely used, and quietly erased, not because they stopped working, but because something more profitable came along to replace them. Number 25. Heroin cough syrup. Bayer, the same company that makes the aspirin in your cabinet right now, launched heroin commercially in 1898. It was not sold as a street drug. It was a cough suppressant, marketed specifically for children. The name heroin came from the German word heroisch, meaning heroic, because test patients described feeling powerful and strong. Mothers gave it to children with whooping cough. Doctors prescribed it for tuberculosis patients to suppress the constant coughing that exhausted them. By 1910, the American Medical Association had endorsed it. The problem was not that it did not work, it worked extremely well. The problem was that patients who took it long enough did not want to stop. It was removed from legal sale in 1924. The cough is still there. The prescription now costs $40. Number 24. Cocaine toothache drops. In 1885, Lloyd Manufacturing Company sold cocaine drops for children's toothaches. The bottle showed a cheerful child on the label. Dentists injected cocaine directly into the gum before extractions from the 1880s through the early 1900s, a practice that was not only legal, but considered a significant medical advance over operating on fully conscious patients. Karl Koller, an Austrian ophthalmologist, discovered cocaine's anesthetic properties in 1884 and published the findings that launched its pharmaceutical career. It was cocaine, not Novocaine, that made painless dentistry possible. Novocaine, developed in 1905, was built specifically to replicate what cocaine did without the dependency. The original worked better. The replacement was patentable. Number 23. Laudanum. Laudanum was tincture of opium dissolved in alcohol, and for 3 centuries, it was the most commonly prescribed medicine in the Western world. American doctors gave it for everything: pain, diarrhea, insomnia, menstrual cramps, teething in infants, anxiety, and what physicians of the era called female hysteria. It was available without prescription in every American pharmacy through the early 1900s and was kept in most middle-class homes as a standard household remedy, the way ibuprofen sits in a kitchen cabinet today. An estimated 1 in 200 Americans was dependent on it by 1900. When the Harrison Narcotics Act passed in 1914 and required prescriptions, millions of ordinary Americans, housewives, clerks, farmers, found themselves classified as addicts overnight. The medicine did not change. The law did. Number 22. Radium water. Between 1918 and the early 1930s, a product called Radithor was sold across America as a health tonic. It was distilled water containing small amounts of radium, and it was marketed as a cure for over 150 conditions, including impotence, arthritis, and general fatigue. Eben Byers, a prominent Pittsburgh socialite and amateur golf champion, drank nearly 1,400 bottles over 2 years on his doctor's recommendation. His jaw fell off. He died in 1932. The Wall Street Journal covered his death under the headline, "The radium water worked fine until his jaw fell off." The FDA moved to restrict radium products the same year. Before Byers, Radithor had been sold for 14 years with no federal intervention. It took a famous man's jaw to create urgency. Number 21. Cannabis tincture. Before 1937, cannabis was listed in the United States Pharmacopoeia as an accepted treatment for over 100 conditions, including migraines, insomnia, menstrual pain, and muscle spasms. Every major pharmaceutical company produced cannabis tinctures. Eli Lilly, Park Davis, and Squibb made them. Doctors prescribed them routinely. When Harry Anslinger's Federal Bureau of Narcotics succeeded in passing the Marijuana Tax Act of 1937, it was not because cannabis had been evaluated and found dangerous. It was because DuPont had just patented nylon, which competed with hemp fiber, and the newspaper industry had investments in timber that competed with hemp paper. The medicine that had been in the pharmacopoeia for decades was removed for reasons that had nothing to do with medicine. Number 20. Calomel. Mercury chloride, called calomel, was the most prescribed medicine in American history by volume. It was the standard treatment for virtually every illness from the Revolutionary War through the Civil War era. Doctors called it the Samson of the materia medica. Patients were dosed until they salivated heavily, and physicians interpreted that as the body expelling disease. The salivation was mercury poisoning. George Washington's physicians gave him 10 grains of calomel in the final hours of his illness. Historians now believe the mercury treatment contributed directly to his death. The man who treated more American soldiers than any other physician during the Civil War, William Hammond, was court-martialed partly for trying to ban calomel from military medicine after watching it kill patients. He was eventually vindicated. The medicine was not. Number 19. Bromide sedatives. From the 1860s through the 1940s, bromide salts were the primary treatment for anxiety, epilepsy, and insomnia in the United States. They were available without a prescription, sold in grocery stores alongside food, and consumed by millions of Americans daily. The phrase bromide, meaning a dull and unremarkable statement, entered the English language because people on chronic bromide sedation became slow and flat. Long-term use caused bromism, a form of chronic poisoning that produced depression, psychosis, skin sores, and memory loss. When barbiturates became available in the 1940s, bromides were phased out. Barbiturates caused dependency and overdose deaths. When benzodiazepines arrived in the 1960s, barbiturates were phased out. Each replacement was marketed as safer. Each created its own crisis. Number 18. Bloodletting as medicine. For over 2,000 years, and formally in American medicine through the mid-1800s, removing blood from the body was considered the primary treatment for nearly every serious illness. The logic was humoral. Imbalanced fluids were thought to cause disease, and removing blood was supposed to restore balance. George Washington had approximately 5 pints of blood removed in the 12 hours before he died, a treatment his physicians considered aggressive and appropriate given the severity of his illness. He had between 8 and 9 pints total. Benjamin Rush, one of the most prominent American physicians of the founding era, advocated removing up to 4/5 of a patient's blood in severe cases. Patients who survived did so despite the treatment. It remained in official medical practice in some American hospitals until the 1880s. Here's where this list stops being about the past. Every item you have heard so far was eventually recognized as wrong, harmful, or simply profitable rather than effective. Each one had professional endorsement. Each one had prescribing physicians. Each one was defended as the standard of care. The question the medical establishment does not want you to sit with is simple. How do you know which current treatments will be on this list in 50 years? The answer is that you do not. What you can do is ask the question. Keep asking. 17 more. Number 17. Thalidomide. In the late 1950s and the early 1960s, thalidomide was sold across Europe, Canada, and Australia as a sedative and as a treatment for morning sickness in pregnant women. It had not been approved in the United States, largely because a single FDA reviewer named Francis Kelsey repeatedly refused to approve it despite enormous pressure from the manufacturer. Worldwide, thalidomide caused severe birth defects, primarily phocomelia, the absence or severe underdevelopment of limbs in an estimated 10,000 children in the countries where it was approved. In the United States, because of Kelsey's refusal, the number was 17. One person's insistence on adequate safety data against a pharmaceutical company's pressure protected an entire country. Kelsey received the President's Award for Distinguished Federal Civilian Service from John F. Kennedy in 1962. Number 16. Lobotomy. Walter Freeman performed the first American lobotomy in 1936 using a technique he later refined into the transorbital procedure, driving an ice pick through the eye socket into the brain with a regular carpenter's mallet. He performed over 3,000 lobotomies during his career, including on outpatients. He traveled across the country in a vehicle he called the lobotomobile. The procedure was praised by mainstream psychiatry and covered approvingly in major newspapers. Its developer, Egas Moniz, received the Nobel Prize in Physiology or Medicine in 1949. Freeman's most famous patient was Rosemary Kennedy. The operation was done at her father's request without her consent or her mother's knowledge. She spent the remaining 64 years of her life institutionalized. The Nobel Prize for lobotomy has never been revoked. Number 15. Amphetamine inhalers. From 1932 through 1959, Benzedrine inhalers were sold over the counter in American pharmacies without a prescription. They were marketed for nasal congestion. Users quickly discovered that cracking the inhaler open and swallowing the amphetamine-soaked strip inside produced a powerful stimulant effect. Truck drivers used them to drive without sleeping for days. Students used them during exam periods. The military issued Benzedrine tablets to soldiers and pilots in World War II as standard equipment. Approximately 180 million amphetamine tablets were distributed to American forces during the war. When inhalers were finally restricted in 1959, pharmaceutical companies reformulated the drug and marketed it to children diagnosed with hyperactivity. The substance did not change. The label did. Number 14. Arsenic complexion wafers. From the 1890s through the 1920s, arsenic was sold in tablet form across America as a beauty product. Dr. James P. Campbell's safe arsenic complexion wafers promised to clear the skin, brighten the complexion, and produce a luminous glow. The glow was real. Arsenic causes peripheral vasodilation, which brings blood to the surface of the skin and creates temporary brightness. The product was legal, advertised in women's magazines, and consumed daily by thousands of American women pursuing the fashionable, pale, luminous complexion of the era. Chronic arsenic consumption causes peripheral neuropathy, skin lesions, and several forms of cancer. The Pure Food and Drug Act of 1906 began requiring ingredient labels. The product did not survive the transparency. Between the 1930s and the 1950s, American tobacco companies ran advertising campaigns using physicians as spokespeople. One campaign declared that more doctors smoked Camels than any other cigarette, and it cited a survey of 113,597 physicians. R.J. Reynolds distributed free cigarettes to hospital patients. Cigarettes were included in American soldiers' ration kits through World War II. The Journal of the American Medical Association accepted tobacco advertising through 1953. The first major epidemiological study linking smoking directly to lung cancer was published by Dahl and Hill in 1950. The AMA continued accepting tobacco advertisements for 3 more years after that study was published. 50 million Americans died of tobacco-related illness in the second half of the 20th century. The physicians who appeared in those advertisements knew they were physicians. They did not always know they were doing harm. From 1940 through 1971, American physicians prescribed diethylstilbestrol, a synthetic estrogen, to approximately 5 million pregnant women to prevent miscarriage. It is often called DES. It did not prevent miscarriage. Multiple studies from the 1950s onward showed it had no effect on miscarriage rates. Physicians kept prescribing it. In 1971, Researchers discovered that daughters of women who took DES during pregnancy had dramatically elevated rates of a rare vaginal cancer. Sons had elevated rates of genital abnormalities. Grandchildren of women who took DES show elevated rates of certain health conditions, making it one of the only pharmaceutical disasters documented across 3 generations. The drug was prescribed based on theoretical pharmacological logic, never on clinical evidence that it actually worked. It was prescribed to 5 million women before anyone confirmed it did what the label claimed. Here's the pattern that connects every item on this list. In almost every case, the harm was documented before the practice ended. Studies existed. Evidence existed. What also existed was money, professional reputation, institutional investment, and the powerful human tendency to trust what physicians had already endorsed. The remedies your great-grandmother used were removed because they could not be patented, and because better-funded alternatives arrived to replace them. The medicines on the second half of this list were removed because the evidence of harm eventually became too large to contain. That difference matters. It matters when you evaluate what you are being prescribed today. Number 11. Paregoric. Camphorated tincture of opium was sold without a prescription at American pharmacies from colonial times through the 1970s. It was the standard treatment for infant diarrhea and colic. Mothers gave it to crying babies. It stopped the crying because it was opium. Paregoric was classified as a controlled substance, requiring a prescription only in 1970 under the Controlled Substances Act. Before that, anyone could purchase it. Pediatricians of the era prescribed it for teething. Grandmothers rubbed it on gums. The stopping of infant crying was interpreted as the curing of infant pain. Pharmacologically, it was. The question of whether opium was the appropriate mechanism for infant pain management had not been asked, because infant pain management was not yet considered a medical category requiring serious investigation. Methaqualone was developed in India in 1955 as a safer alternative to barbiturate sleeping pills. It was introduced to the American market in 1965 under the brand name Quaalude and prescribed routinely by physicians for insomnia and anxiety. By the early 1970s, it was one of the most prescribed sedatives in the country. It was also highly euphoric, which pharmaceutical companies had not mentioned in their promotional materials. By 1972, Quaaludes had become one of the most widely abused drugs in America. The manufacturer knew about recreational use patterns by 1970. The drug was not scheduled as a controlled substance until 1973. 3 years passed between documented widespread misuse and regulatory response, during which physicians continued prescribing it and pharmacies continued filling those prescriptions. Number 9. Senna laxatives marketed as weight loss. Throughout the late 1800s and early 1900s, Senna-based laxative products were sold under names including Dr. Peter's Blood Cleanser and dozens of similar formulations, marketed not as laxatives but as weight loss cures, complexion treatments, and general health tonics. Senna is a legitimate and still used laxative plant with a documented medical history stretching back to 9th century Arabic medicine. The plant itself is not the problem. The marketing was the problem. Women who purchased these products for weight loss developed laxative dependency, electrolyte imbalances, and in severe cases, permanent damage to the colon's nerve tissue. The active ingredient was real. The claimed benefit was invented. That combination is older than pharmaceutical regulation, and it has not gone away. Number 8. Fen-phen. In 1996, the combination of fenfluramine and phentermine was the most prescribed weight loss treatment in the United States. Doctors wrote 5 million prescriptions in 1996 alone. The drugs worked. Patients lost weight. In 1997, researchers at the Mayo Clinic published findings that fen-phen caused heart valve damage in a significant percentage of users. The FDA moved to withdraw fenfluramine from the market within weeks of the publication. American Home Products, the manufacturer, had received reports of heart valve problems before the Mayo Clinic publication. The drug had been on the market since 1973. The combination regimen that became fen-phen was never formally approved by the FDA. Physicians prescribed the two drugs together off-label. The manufacturer settled class action lawsuits for approximately $21 billion. The weight has not gotten easier to lose. Number 7. Opioid painkillers as non-addictive. In 1980, a letter published in the New England Journal of Medicine, just 5 sentences long, stated that among hospitalized patients treated with opioids, addiction was rare. The letter was not a study. It was an observation. It was cited over 600 times in subsequent medical literature as evidence that opioids were safe for chronic pain management. Purdue Pharma used this framing, among other strategies, when launching OxyContin in 1996 and training its sales force to tell physicians that the risk of addiction was less than 1%. By 2017, opioid overdoses killed over 47,000 Americans each year. Purdue Pharma pleaded guilty to federal criminal charges in 2020. The 5-sentence letter in the New England Journal of Medicine was still being cited in medical literature as late as 2017, 37 years after it was published. Number 6. Merck launched Vioxx as a painkiller in 1999 with extensive marketing to both physicians and directly to consumers. Internal Merck documents obtained during subsequent litigation showed that company scientists had identified cardiovascular risk signals as early as 1997, 2 years before launch. An independent study in 2004 confirmed that Vioxx significantly increased the risk of heart attack and stroke. Merck withdrew the drug in September 2004 voluntarily and before the FDA required withdrawal. An estimated 88,000 to 140,000 Americans had heart attacks during the 5 years Vioxx was on the market. A 2005 analysis in The Lancet estimated that 55,000 patients may have died. Merck settled related litigation for $4.85 billion. The drug had been prescribed to 80 million patients worldwide before withdrawal. Number 5. Hormone replacement therapy as heart protection. Through the 1990s, observational studies suggested that postmenopausal women taking hormone replacement therapy had lower rates of heart disease than women who did not. The pharmaceutical industry promoted hormone replacement therapy aggressively as heart protective. In 2002, the Women's Health Initiative, a large randomized controlled trial with more than 16,000 participants, found that combined hormone replacement therapy actually increased the risk of breast cancer, heart disease, stroke, and blood clots compared to placebo. The observational studies had been confounded by the fact that women who chose hormone replacement therapy were generally healthier to begin with, a problem called the healthy user bias. For years, physicians had been recommending a treatment for heart protection that increased cardiovascular risk. The randomized trial revealed what the observational data had hidden. Number 4. Shock therapy sold as a cure. Insulin coma therapy, which induced hypoglycemic coma in psychiatric patients through massive insulin injections, was introduced in 1933 by Manfred Sakel and became a standard psychiatric treatment across American and European hospitals through the 1950s. Patients were put into comas for days at a time. The treatment was painful, dangerous, and produced permanent memory impairment in some patients. It was defended by prominent psychiatrists, practiced in prestigious hospitals, and covered approvingly in mainstream medical publications. In 1953, Harold Bourne published a paper in The Lancet arguing there was no evidence it worked. He was largely ignored. By 1960, controlled studies confirmed it was no more effective than rest alone. The treatment was abandoned. The patients who had been treated could not recover the memories the treatment had taken. Number 3. Tonsillectomy as routine. Through most of the 20th century, Tonsillectomy was the most commonly performed surgery in the United States. By the 1950s and the 1960s, a significant percentage of American children had their tonsils removed as a standard preventive measure. Pediatricians recommended it routinely. The belief was that tonsils were vestigial, prone to infection, and better removed. Tonsils are, in fact, a functional part of the immune system, lymphoid tissue that produces immune cells and helps train the body's defense against pathogens. A 2018 study in JAMA Otolaryngology tracking over 1.2 million Danish children found that tonsillectomy before age 9 was associated with a 2 to 3 times increased risk of certain respiratory and other infectious diseases later in life. The surgery that was standard practice for decades increased the risk of the exact conditions it was supposed to prevent. Number 2. Electroconvulsive therapy without consent. Electroconvulsive therapy, ECT, is a legitimate treatment for severe medication-resistant depression that remains in use today under carefully controlled conditions and with patient consent. What belongs on this list is the mid-20th century version, in which ECT was administered without anesthesia, without muscle relaxants, and without patient consent in psychiatric facilities across America. Patients broke vertebrae from the severity of the convulsions. Memory loss was severe and sometimes permanent. The treatment was used punitively in some institutions as a management tool for disruptive patients rather than as a therapeutic intervention. The 1975 film One Flew Over the Cuckoo's Nest was not a significant exaggeration of documented institutional practices. The patients who received ECT under those conditions had not agreed to it. They did not have the legal standing to refuse. Number 1. The Tuskegee Study. From 1932 through 1972, the United States Public Health Service enrolled 399 black men in Macon County, Alabama, who had syphilis into a study called the Tuskegee Study of untreated syphilis in the Negro male. The men were told they were receiving treatment for bad blood, a local term covering multiple conditions. They received no treatment. When penicillin was confirmed as effective for syphilis in 1947 and became the standard of care, the men in the study were not offered it. The study continued for 25 more years. Participants were actively prevented from receiving treatment elsewhere. 40 men died of syphilis. 199 wives were infected. 19 children were born with congenital syphilis. The study was not leaked or exposed until a participant in the study told a reporter named Jean Heller. She published the story in 1972. The study ended. No physician who participated was criminally charged. The United States government formally apologized in 1997, 25 years after the study ended and 65 years after it began. Here is what all 25 items on this list have in common. Every single one was endorsed, practiced, or permitted by the medical establishment of its time. Every one had professional defenders. Every one was presented to patients as standard care. The history of medicine is not a story of continuous progress from darkness into light. It is a story of genuine advances tangled with genuine failures, all presented with the same confident certainty. The patients in every case had no easy way to tell the difference. What you can do now is exactly what your great-grandmother did before any of this existed. Ask who benefits. Ask what the evidence actually shows. Ask what is being replaced and why. The questions do not guarantee safety, but they are the only tool that has ever worked. Subscribe to Forgotten American Ways. Understanding what was done wrong is how you recognize what might still be.